Recording in progress.
All right, good evening. Today is Thursday, the 13th at 6 o'clock. Welcome to the meeting of the Sacramento Metropolitan Fire District Board of Directors. We will start our meeting with a roll call, please.
Yes. Director Sailors.
Present.
Director Weber.
Here.
Director Sheets.
Present.
Director Wood.
Here.
Director Rice.
Here.
Director Jones.
Here.
Director Costa.
Here.
Director Clark.
Present.
And for the record, President Gould will be absent this evening. Thank you.
Thank you very much. Director Weber, would you lead us in the flag salute, please?
I pledge allegiance to the flag of the United States of America, and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. For those interested in the Metro Cable announcement, it is in the published agenda that is online. Our meeting today will be replaying tomorrow, and you can find that location there in the agenda. We'll move on to the public opportunities to discuss matters of public interest within the district jurisdiction, including items on or not on the agenda. Do we have any speakers, Madam Clerk?
I have no speaker cards and currently no online attendees wishing to speak.
Thank you. We'll move on to consent items then. Do we have any questions on the consent calendar? Nope. Do we have a motion and a second on it?
I so move.
Second.
Got a motion from Director Clark and a second from Director Rice. Would you
Thank
call the
you.
roll, please?
Yes. Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes. The consent calendar is approved.
Thank you very much. We'll move on to presentation items. We have Assistant Chief Rudnicki and Assistant Chief Johnson to start with on service delivery update. Welcome.
Chief, colleagues, my name is John Rudnicki, Assistant Chief of EMS, and with me tonight is Mike Johnson, Assistant Chief of the C Shift Commander. Tonight we are giving you a service delivery update. This is follow-up to the last one you received back in February the 22nd from Chiefs Mitchell and Jeff Fry as well. Do you have controls of those slides? Or? Oh, where is it? Oh, there we go. Figured it out.
Good evening. So as Chief Rudnicki said, your last update on service delivery was at the February 22nd meeting where we were talking about next steps, and I'm honored to report that all of these things have come true with a minor adjustment. So the direction that the ops team was given was to look at adding a third squad into the system and transitioning 2 of our FDMs to MMP ambulances, which we achieved. The variable that was in there was that we were hoping with the numbers of the graduating class of 24-1 that we would see 7 additional firefighters move into the extra manpower pool. Based on lower graduation numbers, we are down to 2, but we do have a 2-person pool, so that's the right start. So the ops team came together multiple times using what we call the Metro Fire Bible, or mainly the standard to cover. Shout out to Jeff Fry and his team, not only for an incredible document that has put a lot of things that we felt could feel in the field, but put it down into a document that after, 6 hours of holding our hands finally made sense to us. There's a lot of very good information in there, as you all are aware. But that's mainly what we used to come up with the decisions that we made. So the squad that we added into the system was Squad 102. Based on the call volume in 102's area, from the data, it was just over 2,000 calls for service, and not having a first responder out of there gave us a 0% reliability. So Squad 102 was decided. That coupled with the fact that we had the facility, there was not a tremendous amount of work from a facility standpoint that needed to be done, but also the fact that we were able to utilize the EMS 24 company officer to work as a station level captain supervision for those folks that are there. Since that day, we have 28 days worth of data. This all went into effect on the 13th of May, and they are running an average just under 8 calls a day. So what that means, obviously, is they're serving that area that wasn't serviced with a first responder before, but Station 103, Station 109, Station 106 like the squad more than anybody, because that means that they're not having to run into there. In addition to that, we transitioned Medic 25 from FDM over to an MMP and Medic 41. Those were 2 of our highest time on task ambulances, sitting at 45% and 42% respectively. So based on the shift schedule of 24 hours versus the 48 hours, those 2 made sense, the most sense to us from a risk and safety perspective to our personnel. That has since been ground checked with the company officers at those stations, and they concur that not only has the transition been smooth, but it's really kind of helped them open their eyes to the single role, get new people in their station, and it's so far been received really well. Let's see here. Sorry, Johnny, I think I jumped ahead of you.
I could jump in and, let me just
Yeah.
jump in and expand on a few of those items. So the flexibility we have with our ambulances is great. And what I mean by that is we have 20 Metro ambulances. 11 are staffed with FDMs or firefighters, paramedics, and 9 of them now are MMPs. Coupled with that is as you're aware, we have our 10 units that are AMR staffed. So when we made these moves, we really looked holistically at essentially 30 ambulances of what made sense to cover our district. And in addition to the moves that we just talked about, we were able to look at another unit, which was staffed out at Station 112. And this unit is staffed when we have extra bodies, and we're able to relocate it to 26's area. So I understand you're hearing a lot of numbers of all these movements, but what I'm trying to elaborate on is the fact that we look at our whole system, specifically at Metro Fire, and these 30 units that we control and where we put them, and the impact they have. With the extra bodies that we had out of the last MMP Academy, we were also able to staff 2 BLS ambulances. So if you recall, a year ago, we did this out of Station 24. And at this time, we're able to try that again with 2 of them and they're working 10-hour shifts. And so what it's allowing us to do is to look at how a BLS ambulance can provide that correct care at the right level of service to those patients. And then on the other side of it, what we're balancing is how often does a paramedic have to ride in on that ambulance and go to the hospital? As you are all aware of APOD and all those factors, those are the complexities that we're trying to manage and watching carefully with the data. So again, this is a month old, but those are the changes that we've made in addition to what was presented to you back in February, which was made possible because we have the extra bodies. So this next slide, when we talk about the extra bodies and what that looks like, the MMP rank is very dynamic. A vast majority are looking to go into the fire academy. As we built this program, we know that there is a career path for those that want it, but it's also a great stepping stone and entry into the fire service or whatever future somebody may have. So we wanted just to include and give you some perspective on where our numbers are today. With the transition or the increase from 7 MMP ambulances to 9, it increased our workforce in that rank. So 74 total MMPs. It takes a minimum of 64 to staff those 9 ambulances. So you can see we have a little bit extra. We're anticipating when that next suppression academy starts, August 10th-ish, right at the beginning of August, 10 or 12 of those MMP paramedics are going to be likely going to that suppression academy. So we're constantly fluctuating and looking at the flow. Again, the priority is service delivery to our community and staffing those 9 ambulances. and supporting our EMTs, or upgrading to paramedic, and making sure we can provide the best service to our community. Soon after the Suppression Academy starts, we will then have another MMP Academy, which we're anticipating about 11 paramedics. And the beauty to this whole program, though it's very dynamic and challenging to manage as you have a lot of people coming in and out and upgrading, we're having a lot of success with our members upgrading. So we're anticipating approximately another 15 upgrading to the paramedic rank by the end of the year. Just in the last year, we've upgraded close to 30 to 35. And right now, today, we have 28 in paramedic school. Some of those are on the suppression rank, but the majority are in the MMP rank. And so what we're finding is the value of the experienced EMTs are getting in our ranks, serving our community, while attending school and being supported by us. They're able to go through that process, which is never an easy lift. There's always a lot of work and time and dedication that goes into it. But they're able to successfully navigate that and then upgrade to the paramedic rank and then move on from there as they choose in their careers. So just want to take a minute to highlight and give you some of that perspective of how we're supporting that program and the dynamics that go in with it. So then, following up from the last presentation, you know, we looked at where we were, what we're doing, and so what's next?
Excuse me,
Yeah,
Chief
please.
Nikki. I had a question about the very informative information you
Sure.
just gave us. When, for example, we have 12 folks move into the academy,
Hmm.
how are those vacancies filled?
Great question. So when you look at our numbers right now, we'll be able to absorb those 12 because we have 74 right now. So if we drop down, we need 64 total in the program. So we'll be shy 2 personnel. And so there's a very slim margin of that could likely be filled with callbacks or overtimes. There are other complexities that come into it at times when people take vacation and things, but our target number is 64 employees. So in the case we're in now, it helps us that we are ahead before the Suppression Academy. Where it can be challenging is if we go into a Suppression Academy even. And so the planning worked out where we're going to be okay. The unique dynamic is as people transition from EMT to paramedic and the timing of all those factors, as we work very closely with the schools to try to expedite that whole process for our employees.
So when we do come up a few short, it goes into the overtime request
Correct?
bucket.
Yep, it will be filled with our membership. They'll get more experience, more opportunity. And then, as you can see, we'll have an academy, an MMP academy right after that, which is a 6-week process. Yeah, no problem. Were there any other questions on this one?
If I can, real quick, also Director Jones and Director Gildo may talk about this tonight in his report out. This is where truly I take the word collaboration and act on it. This is labor management working together to agree to even go above and beyond like the 10% pool numbers that's in our MOU based on data and forecasting of having experience in doing this and opening up the conversation in the entire organization so we can hire based on trends that we've established of who's going to wash out, understanding who washes out early, who has an interest doing something or upgrading, and staying within financial restraints of not getting way out of the budget, but looking at anticipating truly what do we think based on historical perspective of what we're going to lose out of an academy or the new academy, and then hiring just above of what we normally traditionally would do in the past, because we know we're going to absorb those. And so that's taking it off the wall and really acting in collaboration.
Yeah, please.
So a couple of questions. What is the MMP schedule? What is the MIH schedule? And then is Station 27 still available to upstaff their medic?
Great questions. The MMP schedule is extremely dynamic. So they work a day on, day off, day on, 4 off. So they work 48 hours in a week in a 7-day cycle. When we look at how that's laid out, There is literally a flow chart of the shifts. It's not as simplified as A, B, and C shift. There are multiple combinations. So you could be on a Monday, Wednesday, Tuesday, Thursday, Wednesday, Friday. There's also a split shift where you do your first day on one ambulance, one on the other. And it's all because of the numbers we have. Like when we have an odd number of ambulances and or an odd number of people, it creates some dynamics to it. So their schedule is very well laid out. Now the benefit to this schedule is when our students are in paramedic school and their lecture day is on a Tuesday, unlike suppression, they always have set days. So we work with the membership to understand you're going to be in school, we can put you on a Monday, Wednesday, therefore you're open Tuesdays and for your lab day. So there is a benefit in that regard. But yeah, the complexity, I would probably get it wrong if I tried to articulate it much more than that. Got it. So back to your point, the 24-hour shifts they are. They're actually 2 back-to-back 12s, but yeah, overall it's a 24-hour, but 2 12s is how it's written. MIH, they work 4 days, so they're 4 10s is what they work. And currently we actually cover MIH 5 days a week, and so obviously that 5th day is covered by another paramedic, and then as we expand, as you all are aware of, we're building that planning cycle also to have our employees, the paramedic who's on it will work 4 10s, and the providers rotate through as they pick up the shifts.
Good.
Did that answer your questions?
Station 27.
Station 27. So we still do have 3 in-service reserve medics in our system, and yes, we do have 27, 63, and 55.
Thank you very much.
You're welcome. Okay. So what's next? We are always focusing on deploying the right resource and providing the right level of care and capability at the right time, which in healthcare is common in a controlled setting, but I think in the fire service, we're on the leading edge of this as we look at innovations. The BLS ambulance is one example of that, though it's something that's been used in EMS for lots of times in lots of regions, but in our community, it hasn't been. And specifically by Metro Fire, in the last couple of years now, we've trialed this many times as we refine the process. And why that's important is I talked about the dynamics of staffing MMPs and the different qualifications between EMT and paramedics, and how we can work with them and ensure that we're still providing service to our community. Every EMS call is still gonna have a paramedic on it. What we're challenging or trying is the ambulance staffed with BLS or ALS, and when our patients, our citizens need an ALS level of care, they will get the paramedic off the first responder squad to serve them. So we are focused on looking at those different opportunities. All of the things we've done, obviously it's continuous process. So even these changes that Chief Johnson and I have spoke about, there's continuous information gathering and evaluation to confirm what we think is right, such as the ambulance movements, where the squad is placed, how the BLS ambulance operates. And one example of that is our BLS ambulances, they are right now, 40% of the time their calls are ALS. So in this last month, they ran 120 calls or so. 40% of the time is ALS. So one of the concerns is, are we taking first responders out of service? Well, I'll tell you, they're right. What we saw, we did a quick spot check of 20% of those calls, and the wall time on it was 14 minutes, I believe. Yeah, 14 minutes, which by the time you load in the patient, it's really reasonable by the time you do the paperwork and everything. So though the fire engine on those specific cases, when a patient needs a paramedic, they're getting the care, but there is not an overextended wall time or time where the engine's out of service. So we're gonna continue to track items like that to verify that what we're doing to get the right care is not having a negative impact elsewhere. So we're looking at those first responders, the FDM and MMP deployment. And then the big one that's really looking into the future is the alternate service delivery. You are all familiar with MIH. We've talked a lot about it. We've seen a lot of data. We're excited to see it grow here July 1st. Telemedicine's another component of that, of how we use telemedicine. It's something we've dabbled in with our MIH providers. Two of our neighbors, our neighboring fire departments have hired a third party and have dove in deeper to that. And the results are mixed. The use and application is mixed on the ultimate output of how it's helping that patient. So in that case, we're able to work as a region and work with our EMS partners and learn from some of their experiences as well. We talked about the BLS units. Alternate destinations is another one that's gaining momentum in our county. And this is one where we have psych facilities or substance use facilities where the patient can save time and heartache and not going to the emergency room and going to the right location. So the question is, how do we get them there? Currently, we're fortunate with MIH, we do that today. So we're able to save a 72-hour wall time or 72-hour hold in a hospital if you're on a psychiatric hold. But that's one way we can reach our community. Where this is expanding is for paramedics to be able to do that. So the county, LEMSA has taken that to the Board of Supervisors, and they're working through that process to have a transport to alternate destination program. One of the keys to that is the funding source. Obviously, that's always important that we can have some cost recovery. So those are things that are continually being talked about and we're working on as well. The county's committee that they've stood up, we have both Chiefs Perryman and Dr. Schmaltz, our medical director, that are on that. So we're having direct conversations regularly on how this is going to develop and help support our community, which ultimately is going to lead to everything we've talked about, the BLS ambulances, wall times, all those factors. And then the last one that I'll talk about is in dispatch. How do we affect which calls are coming out to our fire stations and the ambulances? Is there a way to ensure the patient gets what they need, but maybe what they need is not a fire engine and an ambulance to show up every time? So you can see how the trickle-down effect could really improve our service delivery and our availability in our community. So that's another area that we're currently navigating and looking into. Could that be beneficial to our system, and how does that work with the many providers in our region?
Chief, if I may interrupt you there.
No, you're fine.
Got a question from Director Rice.
Real quick, Chief, thank you for all this information. I want to make sure I heard you right. Are we doing telemedicine here ourselves, and then other folks have contracted to have it done? Did I misunderstand that?
That is correct.
Can I ask a favor, and I know you guys are already doing it because Sacramento County and you provide some of the best APOT data on a monthly basis. It would be really important if you guys track the use of telemedicine, what's working, what's not working. There is a lot of discussion at the state level with EMSA regarding 201 rights and 224 and all these different response models. And that data, to be able to have it right here in the capital city within the EMS system in the capital is going to be really important. Your work has already been used at those levels, and to hear that, I'm really glad to hear it develop usable data because it's going to be super important.
And just to clarify a little bit, first, I appreciate the comments, and I agree with you. There's a look at how we can use that tool. Locally, with our MIH program, what we're finding is when we think of the flow of a call, our crews are out there, and maybe they're going to reach out to MIH because they can't get there for 20 or 30 minutes. But the end result is if our provider, our advanced provider, does a televisit, what is the next step of what we can do to provide service? And that's where a little bit of the limitation is. The value that some of our neighbors are seeing is we thought that it would be used more for consulting the patients and maybe setting up a follow-up healthcare plan. But where the value is being seen in very small numbers is actually the consultation with the physician face-to-face, which we used to do over radio with like a medical base. For some patients, they want to see that face-to-face, and so they're finding value in that. Again, the reports are very low numbers, but your point's taken of tracking that data. Thank you.
You guys are doing a great job. Just keep it up. That data is going to be so important within the next 12 months.
Okay, thank you.
Thank you. Yeah, just a couple of specific follow-ups, and thank you for that acknowledgement of the data. It can be so important. So Metro Fire is doing telemedicine via MIH. How are we doing this?
Yeah. We have telemedicine in MIH, but I will tell you, it started as a trial process where we don't have big volume. So the capability is there, but as you can imagine, sometimes technology and trialing it in a small pilot period. So for example, we have paramedics who work MIH and they're familiar with the process and flow. So we've given them access when they're working on the fire engines or things. They know how to activate this system and call in to the provider. But this is a little bit of the limitation of our system in the sense of we have one MIH provider 10 hours a day, currently 5 days a week. And so that's one of those obstacles that we can overcome with, we're gonna have a second MIH, but then also the availability of, if they're already on a call, they're unable to answer a telecall. They can't take two at the same time. So there's things that we're trialing and working through and recognizing some value and some things that maybe won't work. And in the end, when we look at alternate service delivery, it's about trialing these things, and that's where I'm proud of where we're at as Metro Fire is we're gonna find a lot of the things that don't work. And telemedicine, to your question, it ramped up for about a month, and then we saw the numbers were so low that we haven't put a lot of more time and buildup. And part of it is we have a big workforce. And we know if we give everybody the tool, we only have one provider 10 hours a day. They're not gonna be able to answer the call. So rather than invest and focus on that right now, we've put that a little on the back burner so we can focus on the second MIH unit and build up some capacity before we start expanding and really hammering down how that model would work.
No, this is great to hear that, we've taken the first steps and we're on our way. That's fantastic. As a second clarification from what you said earlier, if we have an MMP staff, but an ALS call comes in, a paramedic firefighter from the ambulance or the truck jumps on the BLS to make it ALS?
If it is a BLS MMP, then yes, they do.
Okay, and that's decided via dispatch?
No, it's when they show up to the call, they'll assess the patient.
Yeah.
And so if they show up and it's determined it's an ALS patient or they need some intervention from the paramedic, the paramedic's gonna keep it. And we have support.
I'm sorry, sir.
Sorry.
No, is the paramedic on the ambulance or does the engine come out?
Both. So if a citizen calls 911, they'll send an engine or truck and an ambulance. And if that ambulance is BLS and that patient then needs a paramedic, then the paramedic from the first responder will jump on the ambulance and ride to the hospital and continue the same care they would have had,
Oh, okay.
whether it's ALS or BLS ambulance. So we can have that flexibility, but ultimately the service to the community and the safety of our patient is always maintained.
Well, that was our pretty much a standard operating procedure where we cover the paramedic role. So
Yeah,
maybe different words, but we're getting it covered.
we are.
Okay, thank you, sir.
Thanks for the question. One last highlight of an efficiency. It's a little in the weeds, but the regional ambulance numbering. As we look to where we're going in the region, we look to ALS or BLS, we look to MMPs or single rolls or third-party ambulances and AMRs. We needed common nomenclature and words that we all understood what was coming. It's so important that we know if it's a BLS or an ALS ambulance. It's so important if we know if they're staffed with firefighters or not and where they can make a difference. And so the attachment on there's just one example of how this is a county-adopted renumbering process. So any captain, any firefighter, anybody will know when they hear an ambulance number 661 Bravo, it's staffed with MMPs and it's BLS. So I just want to share that's one of the other efficiencies we've done in the last couple months, and officially will be adopted July 1st. Mike, I owe you an apology. I just talked a lot.
It was your show, but.
Any other questions?
Thank you. Do we have any questions?
I have a
Director
follow-up
Costa?
question. Thank you for the presentation. On the first slide, we talked about the potential of a third squad, but I didn't hear anything else about what that would look like or when that would be deployed.
Yeah, it was
Sorry.
deployed on May the 13th.
Oh, okay,
That's
it
Squad
was.
102 that I spoke about.
Okay, sorry, I missed that. Thank you.
Running just under 8 calls a day.
Director Sheets.
Thank you. You know that this is near and dear to my heart, so I really appreciate the work and the effort. You mentioned a couple of things that really stand out for me, which is the right care, right level at the right time. Hospital organizations are all about that because ultimately it's to serve our public, right? That's the best care. So I really appreciate the focus on that. Telehealth is huge. It's not going away, and it's going to be utilized even more. So really just thankful that we are ahead of the curve and we're part of that cutting edge. There was one other thing I wanted to say, but it was on that last slide and I couldn't remember now. It might come back to me, but I'm very excited about this. I think it's the best thing that we can do for our public. And then, that's what it was. The focus for safety, not only for our constituents, but for our members, right? Looking at the data that shows those units that were, back to back calls and not really focusing on maybe the mental health or even the sleep deprivation and what that does to somebody. Being a first responder myself, it's taxing on a body, and like to be able to even recover, even if you work 24 hours and you have that 24 hours off, you're recovering after that 24 hours. So first 12 to 16, you're sleeping, right? And so really, really just want to thank you. It's amazing work that you guys are doing, and it just couldn't be more proud to work for this organization.
Appreciate it.
Any other comments, questions? Thank you guys both, and I just want to add, I appreciate you tying in what you did and what you were talking about to the standard of coverage document. That's such a massive and complex and important document. It's good to remind people of all the things that we're doing and how it relates to that as a governing document for us. So thanks for that. Great, thank you. Next, we'll move on to our community relations update. This is PIO Parker Wilborn. Welcome.
Good evening, Board, Fire Chief, everybody in the audience. Parker Wilborn, Community Relations Team, and I've also brought some guests. I want to start first by acknowledging that we don't do anything alone. We're going to talk about what we've done this past year and where we're going, but I want really the focus to be not just on this division, but everybody out here, all of the divisions, all of the branches that help us get where we need to go. The best part of my career so far, I've been here for 13 years, has been running this division, and I've done a lot of really cool stuff, but I can tell you, being in a position to come into a division and have a team of two, myself and Chris Dargan at the time, and my community relations specialist, or the community relations specialist, being in a separate division, and then pulling them all together, and then building a new team has been an absolute phenomenal experience, and you're gonna learn a little bit about these two behind me. Brenda Briggs is not here, and it's unfortunate because I really wanted to highlight her. She does phenomenal work, as everybody in this room knows. She's been here for 30 years, and she celebrated that this year on January 1st, and we celebrated her then, but I have not been in front of you since to be able to acknowledge her. She is a top-notch person. She manages and supervises the day-to-day for community relations. She's really my go-to, so I'd be remiss if I didn't say something about Brenda. I have two additional folks behind me. We are now fully staffed with the team of four. The two behind me are Allison Mayhew and April West, and they have both completed their probation. So they are fully fledged parts of our team, and they do absolutely phenomenal work. I've never met two more dedicated people within this division than these two. And we're gonna learn a little bit about them. I want each one of them to say a little bit about themselves. We're gonna start with Allison Mayhew, and she's gonna give you a brief preview of, or a recap on what we've done this past year so far, and then we'll have April West come up, tell us a little bit about herself, and then also let you know where we're going from here. So I'm going to turn it over, without further ado, to Allie.
Hi everyone, I'm Allison. Thank you for having me here tonight. So just a little brief background about myself. I am born and raised here in Sacramento. I studied communications and journalism at Sac State, and then after graduation got a job at Fox 40 where I was on their assignment desk. And now I'm here, and I could not be happier to be here. This has just been the best job ever. So yeah, I'm happy to be here. So a big part of my job is our social media, so internal and external engagement. So my days are really always different depending on what's going on that day. So I might be at a training or a drill. I might be filming what a crew is cooking for dinner that night. Or I might be out at a community event with a crew, whether it be a school or a park or a business or wherever they're at. I also get to do really cool things like go on the boats and the helicopter, and so that's a big perk of my job, I guess. So a few things that we've done this year would be open houses, which is another one of my bigger projects. I know a few of you guys have come out to our open houses, and we'll have another one here in a few months. We're shooting for August or September at Station 59. So if you haven't been able to come out to one yet, I highly encourage it and would love to see you guys out there. It's honestly a really good opportunity for the community to meet the crew that might be responding to one of their emergencies one-on-one and kind of get to know them, see the station, the apparatus up close. Another really cool thing is we've actually seen a few older kids come by that are interested in a career in firefighting. So it's just an opportunity for them to ask a crew any questions they might have and kind of get that guidance from them on how they can become a firefighter too. Grant funding and the smoke alarm blitz. We, a couple months ago, did another smoke alarm blitz where we installed over 300 smoke alarms, or provided over 300 smoke alarms, and we hit over 400 homes. We also gave out CO2 detectors and night lights. So that was an amazing thing that we did, and I'm really happy to be a part of that. The Fill the Boot and Safety Fair, the last 2 years, we've had a booth at the safety fair, and then this upcoming year, or next year, 2025, I'll actually be part of the planning committee for that. So just another opportunity for us to collaborate on that event. We also just had a station dedication at Station 62 a few months ago, and then coming up in not too long, we'll have one at Station 50. And then the seasonal newsletter, I'll let April tell you guys about that, but that's a newer thing that we've been doing, and it's been a really great hit, I think. So, thank you guys.
You have the clicker? Okay, let me open up my phone. Hello, good evening, directors. Thank you for having us here. My name's April West. I'm a community relations specialist. I've been on for, since April of last year, and this has been one of the best places to work. I have experience also working in the Parks and Rec at El Dorado Hills Community Services District. I oversaw communications and volunteer over there. So special districts, I have familiarity, but this is my first fire department, and I couldn't be more proud to work here, echoing what you're saying, and just coming to the board meetings and kind of having an idea of what all is going on. But everyone that I work with, it's just, one person impresses you after the next person, and I'd be remiss if I didn't say I have one of the best people leading our team. Thank you, Parker. And also, I don't know very many people that could say that they are learning from somebody with 30 years of experience. So I don't take that lightly. I feel very, very blessed in that, and celebrating Brenda tonight and all year really with her 30 years. So for me, we're going to talk about what's next. Oh, actually, can I do one more thing? Because I was supposed to talk about myself. And I forget to do that sometimes. So I love 5 guys. I'll start with that. So one is my husband, and I have 4 children. So I've got a 2-year-old, a 5-year-old, a 7-year-old, and a 10-year-old. So I'm very active in Cub Scouts also. So I lead some of those activities, and arts and crafts are big hit around my house. So other than that, my husband and I are also dedicated in our communities. We volunteer. He's chairing his grandfather's golf tournament. It's the Drive for Marshall that serves Marshall Hospital. And we volunteer for the 2030 Club up in Placerville. So we are carnies also during the fair. I'll do a plug. Today's day one. If you eat the tacos, 100% of those funds go back into the community. So for myself, I want to read this poem. It's very short, don't worry. It's called Do It Now. It says, I expect to pass through this world but once. Any good thing, therefore, that I can do, or any kindness I can show to any fellow human being, let me do it now. Let me not defer nor neglect it, for I shall not pass this way again. And so just a reminder that we're here for a short period of time and we can actually make an impact. All right, so jumping back in, fire camp. We came with gifts. So fire camp is in about a week and a half, June 25th through June 28th. You are all going to receive some of that swag, a t-shirt, the hat, and then we have some new swag, pens and Post-it notes and really cool football you can throw to a close buddy or maybe somebody else. All right, so Rancho Cordova Youth Center Summer Camp. I'm bringing this up because one of my passions within our division is community development and just creating relationships. And so that looks like through chamber events, through, I've been going out to Kiwanis clubs and Rotary clubs and mostly highlighting fire camp, but also doing some education while I'm out there. And so typically what that looks like is one thing leads to another and they want to partner on different things. And one of their ideas, Rancho Cordova Kiwanis Club, they work with the city at the youth center, and they've been working for a long time to get that youth center up and running, and they've just celebrated 1 year. So at the meeting that I was at this month, they invited us to participate at the summer camp, which we'll go to. But the people who are in those service clubs are so dedicated to the communities they serve, and just finding ways to connect the dots, and whether that's me, like I can go to the summer camp, but sometimes I have to go to other divisions and just present what I find or connect people to what they're looking for. And so this is one of those opportunities that we're going to take. And she had also mentioned how great it would be to have a fire camp here in Rancho Cordova and going through their community impact grant and she's willing to help us go jump through those steps. And so that's the beauty of these meetings, is that even if there's 3 people in attendance or 28, making meaningful partnerships where we can do more with less, so that's kind of, we have grit in our division, I think. And so that's one of the cities. Citrus Heights too, they pulled their community, and the community, I heard Station 27 come up. The community wants to do something special out at 27, so we're partnering with Citrus Heights to have City Scoop out there. Leatherby's is going to sponsor ice cream, so please do join. That's on July 11th. And so then I contacted Sunrise Parks to try and loop them in because Rush Park is next door. And so they're going to be on board. It'll be a lot of different organizations. The Legion Films, this is one of our grant-funded items here that's very important. And I've heard sidewalk CPR come up in this board meeting room also. And so we've come up with several, how many? 6, 8 ideas that we're gonna go through with. One of them, sidewalk CPR, hands-only CPR, sorry, and fire extinguisher training. So we get a lot of requests for these different activities that we can actually point people in the direction of learning about them through the video if we can't reach everyone. And so that's really exciting, something to look forward to. Station 50, as you heard, will be dedicated to firefighter Mark Ball. And his graduating, he was with Florin Fire District, and many people who are still here knew him, and so it'll be a good opportunity to dedicate Station 50. We hope you can make that. We're getting so many requests for National Night Out, so that's on our list, and just being present, helping the crews connect with the communities, and hopefully also offering up to the crews, hey, if you meet someone, if they want to do more with us, please point them in our direction, and we can kind of close those gaps too. So open house at Fire Station 59, Allie's working with Captain Pritchard on that. Date to be determined. No Child Eats Alone is a really big campaign. We're working with Folsom Cordova Unified School District. They're going to lead the charge on rolling this out. So at the end of the month, we'll meet about No Child Eats Alone, the opioid awareness campaign, and which one am I missing? Fireworks safety messages, which we're collaborating with Sac County. And so cancer awareness campaign, that is also on our radar. Parker was able to work out a deal where the engine stays wrapped for 5 years, which is a cost savings of $25,000. Big partnership there, and so that'll get rolled out October and November. And so we're just really excited to be pushing a lot of these things forward, and there's still more things coming in too, but some of what's next, and I'll pass it over to you if we're good. Okay.
So just to expand on the No Child Eats Alone, that was an initiative that was brought to us from Chief House. He'd seen this in other parts of the country and thought Metro Fire can maybe create something here special. So we reached out to Rancho Cordova Unified School District. They want to pilot with us, and they want to try it with 2 elementary schools. So that will be moving forward next school year. What that kind of looks like is Chief House or whoever we designated the executive staff, starting with them, would go and find a child that's eating lunch by himself or herself, and just sit down and hang out and have a conversation. And there's certain age groups that we've statistically looked at and said there's a benefit to this beyond maybe 7th grade. That might actually create more turmoil for the kid, or maybe create some nicknames. We don't want that, but pretty much grade 2 till about middle school, we can really make an impact. And by having badged personnel go in and sit down with the kids, it causes the other kids to wonder why that kid gets a badged personnel to come hang out with them. So that was an initiative that was pushed through Chief House that we're gonna roll with, and Cordova Unified wants to be the start, and we're gonna branch that out to San Juan Unified and a number of other. We have 13 different school districts that we're gonna work with that. So I just wanted to touch on that a little bit more. Moving on, I just have a couple more things I want to go over. We were actually we just merged with CERT. So CERT is now under the community relations umbrella, and they are absolutely phenomenal. We have activated them now 2 times in the last week. We actually activated them yesterday on the Grant Line fire. That was 120 acres, and we knew we were going to be out there for several hours. We activated them, as you can see in the picture. That was 3 or 4 days ago on a 35-acre fire out on Jackson Highway. They came out, they brought protein bars and ice cold waters, and I can tell you at 6 to 7 o'clock at night, if you're out on that fire line, there's nothing better than popping a couple protein bars and going back to work. So very good response from the crews. It was huge. I've got just a couple priorities for CERT. We've met several times already. Recruitment, succession, training, activations, and supporting the program, getting them what they need. We're on a right path. They will be where they need to be here in about 2 to 3 months. They're very excited. We're excited to partner with them. We're excited to see what they're going to do for the community and for Metro Fire. So we're going to keep rolling with that. They've actually provided 2,616 hours to date this year from their personnel, and that's on their own time, their own dime. So these are volunteers that are just coming out and really want to support their community. And that's through the open houses. They're at all of our open houses. They do hands-only CPR. They just do a tremendous amount for us. They really make our open houses what they should be. They're out there doing fire extinguisher training and all kinds of stuff. So they're just great humans, and we're excited to have them as part of our team. So moving forward, Board, you've given 5 priorities in your strategic plan. One of them is external engagement. Now, community relations has a part to play. We are not the only player in that. The way that I read external engagement, or we read it, we are one facet. We've got CRD, that's another one. Operations has a part to play. Economic development, everybody has a part to play in our external engagement. We just have the ability to highlight it. Part of what we're doing is really getting into the federal, state, and local levels. I've got April West has really been tasked with going to chamber and town hall meetings and going to those community events, getting us out there. The newsletter was mentioned. That's something that April's been putting together on a seasonal basis, and we have a really strong following with that. That's going to continue. So we want to get out there at all different levels. Improved Metro Fire visibility. We've been on TV, Metro Fire's been on TV 1,165 times this year. We've been online and print 910 times, and on the radio 209 times. We have a phenomenal following. We have a phenomenal relationship with all of our media outlets. We're continuing to post on the daily on our social media platforms, and we're continuing to see growth. We've actually tripled our following in the last 3 years. So we're going to continue to do that. Moving on, communication strategy. So we talked about the federal, state, and local level. Jeff Fry's been really instrumental in developing our core. It's a core group. So essentially all of the divisions that we talked about, CRD, ourselves, special ops, operations, anybody that has an external footprint, we meet at least monthly, and a core is actually collaborating on related endeavors. And so it's basically we're getting all the people in one room and getting that message consistent and making sure we're all on the same page, we're all saying the same thing. And I think that's very important when you are gonna have an external engagement to be on that same page, and we do that at least monthly. So I said kudos to Jeff Fry for setting all of that, and we're gonna continue to do that. We're just one small part to play in that. As far as crisis communications and real-time media updates, we just downloaded and got set up on the Signal app. I don't know if you're familiar with that, but we have about 100 different media outlets and reporters and anchors that monitor. It's on Signal, but it's basically a group thread. So as I put something out, everybody gets it at the same time. It's consistent. Everyone's getting the same messaging versus what was happening the last couple years. I'd have one media outlet, hey, at one time say, hey, what's going on now? And then 20 minutes later, I'd get Fox 40 that would say, hey, what's going on now? Well, things have changed, so they would get a message. So this outlet over here is putting something out. Now Fox is putting something else out. And then you get a little bit of differentiating information. This really streamlines it. Everybody gets the same thing, same information, and so far it's been phenomenal. I've got really good feedback on that. And then our 12-month safety calendar. So everything we do, we're planning out now. And we've been doing this now, this is our second year. So each month we look at what we need to say, what we need to put out, the safety messages that's appropriate for the season, and we're gonna continue to do that. So there is a plan in play. And then finally, 3A on your strategic plan, the external engagement side, is education services and career awareness. We talked about the digital education. We are in the process of going through the life and safety grant, and it was touched on about the smoke alarm canvassing. We're tasked with doing 6 of those. We broke a record on this last one. It was about a month and a half ago now in Rancho Cordova. We hit over 400 homes and over 300 detectors. It was already stated, but that was actually a record with the Northern California Red Cross. So that was a huge push, not only from our division, but also CRD and also operations that sent a number of crews out there to lift that heavy ruck. So kudos to that entire team. Part of that grant is also creating digital video. So 8 videos, we're looking at different safety messaging, and that's also gonna be, part of those messaging is gonna be for the kids. So we already have 6 videos up that really tackle some of the hard-hitting issues that we see with the kids of not having a home fire escape plan, not wearing a bike helmet. Just simple little safety messaging. We're putting that stuff out on our website, and we're working with the schools to get that out also. There's also printable material that teachers can then print, so they can show the videos in the classroom, print the materials out, and then have us come out for a static display. And we've done that now, I believe, over 50 times within the local schools, so it's working. Still partnered with Del Campo High School Fire Tech Academy, and we're continuing to do those in-person events. And again, a big, huge thank you to the operations division, because we can't go to all those events. We have a team of 4. We really rely on those engine companies, truck companies, and medics to really be the hands and feet for us. Outside of that, hope you enjoy your goodie bags.
Thank you so much, Chief. Appreciate that. Like you said, I don't think we can overstate Brenda's impact on our district over the last 30 years. She's absolutely amazing. I appreciate you recognizing that. But I want to just say, after watching and being out at many events where April and Allison have been, they are amazing. We've got huge assets that you're developing, and it's great to see them grow and develop as well. So thanks for all the work that all of you guys do. It's wonderful. So any questions comments? Director Weber?
With the CERT program, when you meet with them, are you meeting with division heads, leaders, or you're meeting with the entire team, or as many that can make your meetings?
Well, just on the regular meetings, we call them the command staff. So there's basically 4 people. Linda Ford essentially heads up the program, but there's others in there. So I've met with them on a number of occasions already. They needed simple things, like they didn't have an outlet to charge their golf carts, so we're working around that. They needed foul weather stuff, so we're working around that. They had about $2,200 worth of stuff that they needed that they didn't have, the wish list. It's all on order. It should be here within the next week or 2. So they're getting what they need. They're being supported. I meet with them every time they come out to open house. It's really a priority for me to go talk to each one of them and let them know how valued they are, because they are valued. So I do meet with all of them. I've interacted with every single one of them. I've gotten one-on-ones with them of the challenges that they've had and where they want to see this going, because it's not our program. We're just kind of the conduit between Metro Fire. I really want them to carry through their vision and make sure we're doing what they want, while also meeting the succession plan. So we can't just have 1 or 2 or 3 people managing or leading this thing. We need other people coming in behind, and we just had a CERT basic course. We have about 40 active people now within CERT, and we're going to continue to push those numbers up. But all 40 of those people need training, and they need they need to be supported as well. So we're going to do that.
Director Clark?
Yeah, what an asset you guys are to Metro Fire. I've interacted with April before and Allison, and I'm really looking forward to be engaged in some of the other activities that we have coming up. Continue your great work. Thank you so much.
I wasn't finished.
Oh.
Secondly, I want to hats off to your entire crew, especially to Brenda. 100 years ago, I did your job, and everyone knows I can't hold your strap now, but working with Brenda over the years, she's also my go-to. You folks are absolutely phenomenal at what you do, all of you, and kudos to your entire team. You're doing great work. Now I'm finished.
Director Rice.
Just real quick, Parker, and I'm kind of remiss in this, but in just listening to the community relations and all the things that are going on, my side job, I'm the chair of the California Fire Foundation. Please watch the website for grant opportunities. There is a grant period open right now, up to $25,000, and it covers several things from community programming to vegetation mitigation. It closes on June 30th. I'm really sorry to bring that up, but as I listened to April and you guys talking about it, it got my mind thinking. So please look at that. There is local money available for many of the things that you're working on.
I appreciate that. I'll note it. Thank you.
Anyone else? Thank you so much, Chief. Thank you, April. Thank you, Allison. All right, moving on to our action items. Action item number 1 is Administrative Analyst Aaron Castleberry regarding the Zinfandel Phase 3 build-out. Look forward to hearing about this.
I'm looking forward to giving this presentation. All right, so we'll wait for it to come up. Good evening. Tonight, I'm happy to bring you an update on our Zinfandel Phase 3 build-out project. This presentation is going to conclude with a recommendation for this board to approve, to authorize this project to move forward at the budget that's going to be presented tonight and make the contract award that's being recommended tonight. So we will get started here. There we go. All right, so as you remember, in October of last year, this board approved a design-build project delivery method for the delivery of this project. And this was going to be using a two-step best value procurement process. So step one was a request for qualifications process whereby we shortlisted a few potential design build teams. And then those 3 teams were invited to actually compete and submit a proposal for our consideration. So this board in February approved our actual RFP. If you remember, it was like a document this thick, and that was released on February 9th and kicked off our competition process. Our competition process was an 11-week process, and we had the opportunity to meet 3 separate times individually in proprietary meetings with each of the design builders. To answer their questions and provide feedback to them on their design progress so that we could get a project that's going to meet our needs. So the evaluation and selection, you guys approved this back in February with the RFP. Our internal evaluation team was comprised of a selection panel as well as our owner advisor team at Benham. We conducted a technical review of the submitted proposals and scored them against all of the selection criteria that was outlined in the RFP. We actually did receive 2 proposals. One team did end up withdrawing from the competition. So we did have 2 proposals submitted that we evaluated. So the internal selection panel was actually chosen by the executive team. It included members of all 3 of our branches, operations, support services, and administration. And it was a 4-person panel. And I just wanted to take a moment to recognize them. I'm not going to name them personally. But this was an immense effort for them to undertake on top of their regular scheduled jobs. It included no less than, if I calculated correctly, 30 hours of meetings and review in a 10-week period. And this is on top of their normal duties. So it was a big lift. So I'm so thankful to them for participating in that process. Also, I wanted to recognize Courtney Moore, our purchasing agent. She and I administrated this process together along with our owner advisor team and was instrumental as well in keeping the process moving according to plan. So, big thank you to them. Also, huge thank you to our owner advisor team at Benham Design, led by Dylan Motley and Molly Jones. Incomparable service that they've provided to us. They are design, build, and technical experts in this and have provided a lot of support to us. So the basis of this award, as you can see here, is that it was determined it did conform to the solicitation, it was fair and reasonable, and it is providing the best value to the district. So on this basis, based on the evaluation, the highest scoring proposer was DD Construction. So, DD, their design team is led by DD with WMB Architects heading up the design effort, and an engineering team comprised of Siegfried Engineering covering structural, RSC Engineering covering civil, HCS Engineering covering electrical, and ACO Engineered Systems covering mechanical. So we'll get to the exciting things here. This is the design, the overall site plan design concept. If you remember correctly, our goal for this phase of the project, if you remember from my last presentation, given budgetary constraints, we had to really look at the scope of this project. And our scope was to move our training division staff and our firefighter and MMP Academy staff and operations to this site. So that is what you will see here tonight. So you'll see here the overall site plan generally depicts the proposed design in relation to kind of the existing site. You'll also see that it includes some required improvements on Zinfandel Drive that are going to be required for the project, as well as pedestrian access, which is a code issue from Zinfandel all the way up that little street to the site. Generally, this is the localized site plan concept. All of this is still concept. I'll cover that in a moment. It shows how the intended design is situated on the existing site and ties into the existing parking. So south, you can't see it on this, but south on the southern part of this is where the urban search and rescue props are. You can see on the east side, that's our collapsed structure on the far east side. And the parking lot, you'll see there, that is already in existence. So you can see that we're utilizing that space just south of the parking lot site. And then finally, this is the conceptual floor plan shown here. So what we've included in this facility, the training building is approximately just under 16,000 square feet with an adjoining apparatus / outdoor classroom / storage building at about 7,400 square feet. We've got large and small classroom space, office space for the training division and academy staff, including administrative offices, break room, restroom, shower facilities, a large fitness room, about 2,000 square feet, and a space dedicated for recruits, including locker rooms, turnout rooms, shower rooms, restrooms, a large break room. And then in the adjacent secondary structure, we have warehouse storage space for their needs, SCBA cache, PPE cache, all of that kind of stuff. We've got apparatus storage here. This is not a response facility in any way. This is used for academy training. And then it will also, you'll see on the east side of that apparatus, it's just an extended covered area that can be utilized as an outdoor classroom. So this structure is accessible to that building via a covered walkway. So they'll be able to walk kind of to and from those areas covered. So over the next few months, we'll be working, as long as you approve this contract award tonight, we'll be working with our design build team to refine this, incorporate some edits to it, and move forward with the project. So as you recall, the estimated project budget that we discussed in February with the RFP was $17 million. And based on all the information that we now have throughout our RFP process, as well as additional planning efforts that we have conducted on our own separate from the process, our proposed project budget is $17,397,500. So design and construction make up 82% of this, with a recommended contract award of just over $14.2 million. And then aside from the design and construction, we have project implementation costs that make up about 13% of the budget at $2.3 million. And those include items like permitting, special testing and inspection, owner options, the RFP stipend that was approved, performance incentive, and of course, a contingency. And then finally, management and administrative costs comprise just about 5% of the budget at just under $1 million, which includes proposed owner advisor services, which are part of our recommendation tonight, legal services, and labor compliance. So this budget includes the contract award that we're recommending tonight, as well as additional owner advisor services to extend through project completion. So if you remember last year, you approved owner advisor services to get us to contract award. We have seen such a value in those services, and their expertise in managing the design build aspect of this has been so helpful, and we're recommending an additional fee of $325,000 to extend that contract all the way through project completion. So how are we going to pay for this is the big question. So as you know, we received $13 million in state funding. So that's 75% of the project budget. 16% is being proposed out of our development impact fee. This project was considered as part of our impact fee study, so it is an eligible project for that fund. And then 9% has come from other sources, including our real property sales from last year and actually interest income that we have earned on the 13 million. So we've been able to reinvest that back into the project to maximize the impact. So the proposed project budget that we're proposing here tonight for your consideration has been incorporated into our CIP, which you'll see here in a few minutes, as well as our preliminary budget. So the budget that you're going to see tonight from Dave does include this funding. So you'll see how that all looks. So our proposed project schedule, obviously, we're hoping you will approve this contract award tonight. The estimated schedule at this point is remaining design and the permitting process would conclude in February 2025, and construction would follow with a March 2026 completion. So our recommendation tonight is to approve a contract award for RFP 24-2 to DD Construction, to approve an amendment to the agreement with Benham Design for owner advisor services, and to delegate authority to the fire chief or his designee to perform all of the other activities required to effectuate the project. There's going to be lots of little agreements here and there, paying of fees and things like that, that we like to make sure we get handled. So before I turn it over for questions, I'd like to bring up Ryan Ranchod from DD Construction to introduce himself and say a few words.
Thank you, Erin, and good evening, Chief House and Directors. My name is Ryan Ranchod, and on behalf of DD Construction, we would like to express our sincere gratitude for being given the opportunity to participate on this incredible development. Our founding philosophy is building with integrity and defining quality, which we expect to deliver consistently throughout the duration of this design-build project. Many thanks again to Sacramento Metro Fire for entrusting the DD team with this legacy facility. Thank you.
Thanks. And that concludes my presentation. So I will take any questions you have. We're extremely excited to move forward to the next phase of this project.
Thank you so much, Ms. Castleberry. I want to say thanks for all the work you guys and your staff did to get the materials in front of us. It was a very comprehensive recommendation report. So thank you for all of that information. Just quickly, before we get on to my other directors, could you expand a little bit on how we got that $13 million in state funding?
Sure. So let's see, this would have been 2022. Through our lobbying efforts, there was an opportunity at the state legislature for members of the legislature to make a member request for funding. So we worked directly with Ken Cooley on that and a big team of people partnering with CPF and 522 and our partners at the legislature when we're able to make a budgetary request to the state. We made it just in time as far as the state budget is concerned. So we were very excited to get that allocation, which was passed in 2022. We received it in early 2023, check in hand, and have been able to add that to our CIP as of February of last year.
Great. Thank you so much. I know this has been around for a while, and it's been the work of a lot of people to get here. I just want to make sure they got recognized. So thank you for doing that. Do you have any comments or questions, Director Rice?
See, I was still a captain here when we were talking about the Zinfandel property, and I'm absolutely ready to go. I'm happy for the department and Aaron, the work that you and your division and finance and everybody have done on this. So you got us ready. You got us ready for tonight.
Director Sheets? Oh, I'm sorry. Any other comments, questions? All right, I'll take.
I have one.
Oh, Director Clark.
I'm glad it's finally here.
As already.
That's all.
I'll take a motion in a second on staff's recommendation.
Mr. Chair, I'll make that. Go ahead. My pleasure to move the motion for staff recommendations, all 3, 4 of them. Thank you.
I'll second.
All right, thank you very much. I've got a first and a second. Would you call the roll, please?
Yes. Director Saylors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes.
Thank you so much. All right, moving on to action item number 2. We have a resolution for janitorial cleaning and maintenance services contract award. Welcome, Mark Jones.
Thank you, directors, Chief House. I've got a tough act to follow here. Mine will not be as exciting as what you've already heard previously, but I'll do my best. I'm Mark Jones, Logistics Manager for the district. Staff is requesting the board to approve an award for professional janitorial, cleaning, and maintenance services for 6 of our administration facilities in order to ensure clean and sanitary conditions are maintained. Additionally, provisions for these services are required per the contract sold between the district and the district's 2 lessees that occupy district-owned facilities. Excuse me. On March 26th of this year, our purchasing division issued a request for proposals, RFP 24-3, to solicit proposals from professional firms for janitorial cleaning and maintenance services for the following locations: Metro Fire Headquarters, this building, 1st and 2nd floors; Metro Fire's Logistics, Metro Fire Training Division, Metro Fire Fleet Division, Metro Fire Communications Division, and one of Sacramento Sheriff County's department locations that lease our property at 2101 Hurley Avenue. Interested firms were required to attend a mandatory job walk at all 6 facilities on April 2nd to familiarize themselves with each location in need of the services. Firms were required to have a representative attend the complete job walk at all 6 locations in order to be eligible to submit a proposal for evaluation. 7 firms showed up for the job walk, and 4 firms attended the complete job walk. We did receive 3 proposals through the OpenGov online bidding portal from the following firms: Citywide Property Services Incorporated, Universal Building Services and Supply Company, and Pride Industries One Incorporated. These proposals were reviewed and scored by an evaluation panel using the following criteria that was listed in the RFP document: qualifications and experience with providing services of similar size and scope, program understanding and methodology, past performance, conformance to the specified RFP format, and the fee proposal. And after review, Pride Industries One was the highest scoring proposer. The contract term is for 3 years with an option to extend for 2 additional 1-year terms. The cost for all 6 locations will be $222,552 for the first year, with an average of a 3.5% increase per year for the remainder of the contract. Now, prior to the proposal submissions, funds were allocated in the preliminary budget for janitorial service in the amount of $213,000. But final budget will reflect the total amount of the contract. So the staff recommends that the board adopt a resolution to approve a contract award to Pride Industries One Incorporated and authorize the fire chief or his designee to negotiate and execute a professional services agreement. Material is similar to the one attached with your information. And with that, I'll take any questions you might have.
Thank you very much. Do we have any questions for Mark Jones? No? Director
One
Weber?
comment, I do have a question for you.
Yes.
After this, it's off topic of this, though. So if you could stick around just for a minute.
All right. Do I have a motion and a
Director
second
Wood?
on this?
Director Wood, if I may?
Oh, sir. Yes, Chief.
We're all about taking care of our members and how proud we are as an organization. So I'm going to get a little bit of my report out, if I may, right now.
By all means.
It's appropriate. So if I could have R. Marie Jones come up to the podium with Mark Jones. We talk about really our members and what they do for this organization. Please join me in congratulating both of them on their retirement. Logistics Manager Mark Jones and Grant Specialist R. Marie Jones on the retirement from the district effective July 1st. Mark is retiring after approximately 19 years of service, and R. Marie after 12 years of service. I can't be more proud to call them friends, but look at the successes and improvements they have made in this organization. They are truly exceptional human beings, and they will be missed. So thank you, and congratulations to you both on your retirement and success in anything you do after this.
Thank you, Chief.
Chief, we have a successor for Marie on the community bulletin that she's been publishing on her own, right?
That's a good question. It is you, yes.
Okay, that is an excellent piece of work that she puts out. And it would be a shame if we didn't keep doing that.
Can you comment on the total dollar amount of grants that you were successful on?
Excellent. Excellent.
Sorry to put you on the spot, but that's what we're about here. So proud to call you both friends and to know you professionally. So thank you both.
Well,
Back
outstanding.
to our,
Director Sheets?
Just curious, so I used to be involved with going to a company named Pride Industries. I'm wondering if it's the same one because it
It's
was a
the big
fantastic.
giant company, Pride Industries,
And
yes.
is this the, can you tell me a little bit more, because I'm not sure if it's the same company. The one that I'm thinking of gives opportunity to, is it the same?
Yeah, disabled
If you can
disabled
just
folks,
tell a
yeah.
little bit about this, because I was absolutely so impressed when I went and visited their headquarters and what they do for the community and what they do for people in the community that might not actually have some opportunities if this organization didn't exist.
Yeah, I don't know a whole lot about the organization itself, but their proposal that they really stressed on outreach to people that are disadvantaged and don't have an opportunity to get hired at other places. They have an extremely successful training program that they do for these people. They follow up. They
Provide transportation.
they just provide transportation. They just help them all along the way, and they're nationwide,
Yeah.
and they have I can't remember how many states they're in, but they're just already a great sounding company. I think it'd be a great benefit to us as well.
Absolutely, 100% agree. It's fantastic. I'm glad it's the same organization.
Yeah.
Anything further? All right, if we can get a motion and a second on staff's recommendation, please.
I'll move said motion.
Second?
I've got a motion and a second. Would you call the roll, please?
yes, Director Sailors,
Aye.
Director Weber,
Aye.
Director Sheets, Director Wood,
Aye.
Director Rice,
Aye.
Director Jones,
Aye.
Director Costa,
Aye.
Director Clark.
Aye.
Thank you, motion passes.
Thank you
Thank you
very
so
much.
Congratulations again. Yeah. All right, moving on to action item number 3. Welcome back, Ms. Castleberry, Capital Improvement Plan, fiscal year 24-25 through 28-29.
Thank you. All right, tonight I am happy to bring you our proposed capital improvement plan for fiscal year 2024-25 through fiscal year 28-29. So I'm going to go quickly through the first couple slides in the interest of time, because you've also seen them like 50 times. So as you know, the purpose of our CIP is to memorialize our capital needs, identify what those needs are, and plan for ways to fund these needs. This is part of our strategic planning framework that plays into our overall service delivery. And outputs from this process inform our budgetary and external engagement processes. This is a coordinated planning effort. It starts really from our master planning documents. It involves all divisions, district-wide. Project managers of the divisions are able to submit projects for their division. They are separated into the 5-year plan and the 1-year plan. As you know, the 1-year plan is a recommended appropriation for the upcoming fiscal year, and the 5-year plan is a projection of needs through 5 years. So this is reviewed by a committee. It is ranked, prioritized based on district needs and priorities. It's reviewed by the executive committee, the executive team, And then it is rolled up into our preliminary budget process and brought for your consideration alongside preliminary budget. So when I last came to you in March with this presentation, we had just finished our committee review. We gave a presentation of all of our submitted projects for the year and what that total dollar amount was. So since then, we have finished our ranking and prioritization process, and we're actually bringing that recommendation to you tonight. There have been a few adjustments made to the projects since we last brought this to you as this process is refined. So we are now projecting a 5-year capital need of $179.5 million. You'll see here how that is broken up across the different project categories. Our largest need, of course, is apparatus and equipment. We have a huge backlog of apparatus and equipment needs, $73.8 million over 5 years. New construction needs of $38.1 million. Station remodel and expansion projects, $24.3 million. Facilities repair and replacement projects at $31.3 million. Land acquisition at $2.4 million. PPE at 8.2, and then some miscellaneous projects that don't quite fit into one of these categories at about $323,000. So we previously reported out on the 1-year appropriations request for capital projects. Those totaled 54 projects for this coming year at $104.9 million. So this is 45 new projects and 9 carryover projects. As a reminder, carryover projects are projects that were approved in a previous fiscal year and not yet complete. So we carry those forward as well as the funding that was appropriated. We carry it forward into the next year. So this was our total 1-year request. Like I said, we are bringing this for you for approval tonight. We will do a revision with final budget. Some of these carryover projects may end up getting done this fiscal year. We'll see. We'll refine those project numbers and bring an update to you alongside final budget. So with the 54 projects submitted, what we're recommending for our fiscal year 24-25 is approving 27 of these projects at $51.9 million. So carryover projects reflect $38.3 million of that, and new projects represent $13.6 million. So we'll kind of dive into what these projects are. The 9 carryover projects at $38.3 million, you'll see obviously our 2 construction projects that are ongoing. And then we had apparatus and equipment approved in previous fiscal years. We are anticipating the type 1s and the ambulances and hopefully also the squads all in this coming fiscal year, actually for real. So we'll see. That's the estimate right now that they will be coming in fiscal year 24-25. We've been waiting several years for some of these. Our land acquisition, we were hoping to have complete by the end of this fiscal year. It's looking like it's going to continue into the summer a little bit. We have some activities that we need to do surrounding appraisal and things there, but that will probably happen later on this summer. So we're going to carry that forward into the new fiscal year. And then a couple of facility repair and replacement projects that were not able to be completed this year. As you know, we had a couple kitchen fires and things going on this past year that kind of trumped some of these projects and the ability of our facilities division to get to these. So these are going to roll forward to next year. For the new projects, there are 18 new projects being recommended. $11.9 million in apparatus and equipment replacement projects. This includes our 3 more automated chest compression devices, some MDC hardware, IT storage appliances, which I think might be the most anticipated project because we're all having network issues here at the district. I know everyone here is going to be very excited about that. Thermal imaging cameras, some more Type 1 engines, some Type 3 engines, 1 ladder truck, more ambulances, a couple fleet service trucks, and a Copter 1 hoist rebuild that is, it's due for its 10-year service upgrade. Personal protective equipment, $805,000. That's annual turnout replacement, wildland turnout replacement, structure helmet, and obviously PPE for our anticipated recruit academy. Facilities repair and replacement projects. We have found a few high priority projects here. We're going to do a roof rehab on this building here. Flooring replacement at a few of our stations. That's getting rid of carpet and putting in non-permeable things there. And then frontage improvements at Station 108 where we have failing concrete that's posing a risk. And then a couple miscellaneous projects, firefighting foam replacement. This is a transition to PFAS-free firefighting foam. So that is a high priority item, and also a station cellular conversion, which is going to help with our communications to the stations. The fund sources here for the total 27 projects, as I said, the recommended funding is $51.9 million. The general fund will cover about $2.6 million. Capital Facilities Fund will be at 37%. That's the largest portion of funding. $19.6 million in the D fund is expected to be offset by about $18.8 million in financing. The CIP budget also includes 30% from the Development Impact Fee Fund, 27% from the Special Projects Fund for Zinfandel, and 5% from the General Fund, and then a little portion of the L Fund for that portion of the roof replacement here. That leaves 27 projects that were not recommended for funding in the upcoming fiscal year, with an unfunded need of $53 million. You can see the breakdown there. $22.7 million in ongoing apparatus and equipment replacement projects that will continue to be deferred for now. $16.6 million in facilities repair and replacement projects, $12 million in new construction, and $1.7 million in PPE. So I will be happy to take any questions you have here before you discuss our recommendation tonight.
Do I have any questions for Ms. Castleberry? Thank you so much. Appreciate that. Then moving on then, if I will take a motion in a second on the staff recommendation.
So moved.
Second.
I've got a motion and a second. Would you call the roll, please?
Yes, Director Saylors?
Aye.
Director Weber?
Aye.
Director Sheets? Aye. Director Wood?
Aye.
Director Rice?
Aye.
Director Jones?
Aye.
Director Costa?
Aye.
Director Clark?
Aye.
Thank you.
Thank you.
Thank you again. All right, moving on. We have the 2024-2025 preliminary budget with CFO Dave O'Toole. Welcome.
Good evening, Directors, Fire Chief House, colleagues, members of the public. While this slide is coming up, I'll be presenting the fiscal year 24-25 preliminary budget. And the proposed budget before you is built on the latest revenue expenditure data that we've collected in-house, as well as requests for fiscal changes for the upcoming year. As we always do, the reference point for this budget will be the most recently adopted budget, which was the mid-year budget in 23-24. It was the last time we met to talk about a budget. So in terms of the plan for tonight, the brief agenda looks like this. We've got a couple slides with a general fund overview, or excuse me, with a budget overview of all funds. And then we'll dig into the general budget with the revenues, expenditures, and then the long-term forecast, looking at 5 years. We'll do a tie-in with the CIP plan we just heard about, and then recommendations and questions. So first, let's look at that big picture overview again. So this would answer a couple of questions you often get, which is how big is the Metro Fire's budget? If you look at the expenditures line in the general fund, you would answer $304 million, but probably the number that you probably refer to most often would be this almost $374 million. That's the size of the budget when people typically are asking what the expenditures are. And then the reserve, you can see all the way at the bottom of the slide, $34.7 million or 11.3%. So let me dig into these numbers a little bit closer. The general fund Reading off the slide there, the revenues we anticipate from all sources are 280 million, almost 281. Expenditures, 304 million. Transfers in 16.8 million, which leaves a gap of about 6.8 million. So our expenditures are exceeding our revenues and our transfers in. And how does that get balanced? It gets balanced by drawing from the reserve, from the general fund reserve, which is not something we frequently do. And I want to say a couple things about that. This was part of our projection when in recent budgets we've been anticipating with property taxes that the rate of growth was going to go down. We've seen it. 2 years ago it was 7.8%. This year it's 5.7%. Next year we're expecting about 3.7%. And I'll show those projections in a later slide. But that's a big reason. And then there are also some economic factors happening which you're aware of too. Of course, the inflation has been steadily high, and also the interest rate, the Federal Reserve rate has not come down. We're anticipated to have 6 reductions this year. We've yet to have 1. That's really holding back the housing sales, which would generate property tax revenues for 24-25 as well. So a couple factors there. Also, this is not entirely unexpected. When we passed the final budget last year, we anticipated a reserve of 11.8%. This is 11.3, so it's a bit lower. This is about $1.5 million. And we'll see what happens in final. Sometimes we can, when final, we'll see a little uptick. But that's where we are with the general fund, and the reason why this budget proposes to take 6.8 million out of the reserve this year. Looking at the all funds column, the revenues, 322 million, you have expenditures at 373, you have net transfers in of 17.4 million, which is a change in fund balance of 34.5 million. And so to explain where that 34.5 million, of course it includes the 6.8 million, the general fund I just explained, but it also includes the Zinfandel, that's about 14 million there. Includes about 10 million from the Development Impact Fees Fund for station development, which is also in the Capital Facilities Plan, and includes about 4.6 million out of the Capital Facilities Fund, which is what we typically do to drain it down, or not drain it down, but take a large amount of the funds out of that account and then replenish it the next year with general fund. So that is the big picture of the budget. And I want to, on the next slide, this is starting to look like a familiar slide as well, but this is the preliminary budget overview of all funds. So wanted to present for you, you can see all 7 funds. You can see the beginning balance was. Another word for that would be carryover. That is the amount that we will have, that we expect to have on July 1 of this year. That amount that carries over from June 30th, if you will. And that's that shaded line, the top shaded line. And then the next 4 rows are the revenues, expenditures, net transfers, change in fund balance, the activity we expect to happen during the fiscal year. And then you have an ending fund balance. So what happened, you had the beginning fund balance, you have the activity in the middle, and then the ending fund balance is the amount. So looking at general fund, again, the revenues will look like familiar numbers again, 280.8 million in revenues. Again, the expenditures of 304 million, net transfers in of almost 17 million, and then that general fund transfer of 6.8, or that change in fund balance is 6.8 is the amount that's coming out of the general fund. You can see the general fund gets reduced from 41.5 down to 34.7, which is what makes up the 6.8 million. Capital Facilities Fund, we start the year with a balance of 5.7. There's no revenue source into the Capital Facilities Fund, but there are expenditures of nearly 26 million. There are transfers coming into the Capital Facilities Fund of 20.7 million about, which will reduce, when you put those 2 numbers together, we're going to reduce the fund balance by 4.9 million. We expect to end the year with about 850,000. The Lease Properties Fund, there's a balance of 1.5, so actually go a little bit in the other direction. The revenues will exceed expenditures. We expect to build up that fund, 1.9 million roughly. The Grants Fund, as you expect, we want to spend everything in the Grants Fund every year, so we'll start with a 0 balance. We'll have some funds come in. At this point, we expect to have a little bit of a balance of about 200,000 at the end of the year. We'll update that with final, but typically would spend everything out of the Grants Fund. Development Impact Fees Fund, I mentioned we have about 10 million there. We plan on spending it all. This will be a big year for us, a lot of station investment projects there. IGT Fund is a fund that we receive funds into, and we immediately transfer them over to the general fund. So we expect to get about 34 million in there from the 2 IGT programs, the Voluntary Rate Range Program and the Public Provider Ground Emergency Medical Transport Program, PPGMT, and then transfer that to the general fund. There's a special projects fund. Again, we expect to spend the roughly 14 million shown there on Zinfandel. And then the total at the right, we expect to have a balance across all funds at the bottom right corner of the slide of $37.6 million. Next slide. So I mentioned I would go from the big picture into general funds, starting with the revenues. So again, there's that $280.8 million is the amount we expect in revenues next year. That's an $8.6 million increase over the mid-year budget. On the property taxes, we expect that to grow by $7.5 million. That's about a 3.7% increase. Charges for services, largely EMS, charges for services will be at $65.4 million, a $2.8 million increase. Includes EMS fees with a $2.3 million increase, and CRD fees about $860,000. That CRD fee increase is mostly based on the fee adjustments we made last year in 23-24, which some didn't kick in until partial year, so the $860,000 is a full year increase on those fees. Let's see, we do have some offsetting revenues, so we've lowered deployment revenues. We're not expecting to generate as much in deployment revenues as we typically do, and GMT admin revenues, so the old GEMT program, we are still receiving some revenues in this year, 23-24. We do not expect that next year. That's largely offset by reduced expenditure as well, so that's kind of a little bit of a wash. And then the last piece, which is not general fund revenue, but is the IGT revenue transferred to the general fund, would be about 22.8. That's the net figure, which is about $177,000 lower than this year, so it's pretty flat overall. Incidentally, this will be the 12th consecutive year of property tax growth and the 14th consecutive year of revenue growth that we've seen. So we are still riding a steady climb in terms of our revenues year over year. So the IGT programs, again, not a general fund program, but I just want to mention this, and I know there's always a lot of interest in this, as I too share. So there's the VRP program. So it's an intergovernmental transfer program. Both these are intergovernmental transfer programs where we are transferring funds out to another body to be able to, usually DHCS or the federal government, to pull down funds and as you'll see, it works with a net income result. So the first one, the VRP, is for providing medical transport for the uninsured and certain Medi-Cal beneficiaries. We expect revenues of $14.8 million. We transfer 5.8. The net is $9 million. In the PBGMT program, this is another Medi-Cal transport program. Where we expect revenues of about $20 million, we will have to pay up 6.2, net gain of 13.8. So that together, that 13.8 and the 9 gets you to the 22.8 I've previously mentioned. A question that I know is on your mind as well is how much is owed on the PPGMT side. So the amount that's owed through April, and this will be coming to you shortly in a separate report, is about $8 million. And a way to look at that, the way I'm currently looking at $8 million, and checking every month or what are the trends, is that about $4 million of that is about a 4-month lag. So if you look at the trend lines of what we get every month, where what our biller reports and how much we received, if the amount that we're supposed to receive going all the way back to January 2023 is about let's call it 1.7, we are receiving about 85%. After 4 months, we've received about 85% of that. And then it kind of hovers around 85, maybe it ticks up a little bit. So if you take the 4 months, that 4-month lag is about $4 million. So that's kind of a rolling 4-month lag that keeps following us. But I just said there's an $8 million gap. So that other $4 million is that 15%. When I say we get about 85%, we're missing about 15% over the long period. That amounts to about $4 million as well. So when are we going to get the additional $4 million? I'm not including that in the budget because I don't have a good answer for you yet. It is based, that $4 million is largely attributable to a DHCS program for this that they have not paid yet. So they're having conversations with DHCS. I have a meeting coming with them as well, trying to pin them down on when that is coming, but there just is not enough certainty. Maybe that'll change by final for me to include that, but that is an amount that's owed that just cannot be included at this time. Any questions on IGT? I just kind of jumped ahead. Keep going. Okay. So moving from revenues to expenditures on the general fund side, general fund expenditures will be about $17.2 million. That's a 6% increase from the current year. The labor budget, $257.8 million. Labor costs will increase as a share of general fund revenues from about 81.7% this year up to 84.9% in 24-25. Service and supplies will increase about 2% to $42.3 million. That's a really modest increase, and I will really credit the staff here who went through a lot of exercises to try to keep service and supplies costs down. So that's a very modest growth number there. So on the expenditure side, so sticking with labor, again, labor includes a lot of things. It's not just wages, it's overtime, incentives, it's PERS, it's SCRS, it's medical, it's vision. It's a lot of pieces involved in that. But taking the compensation part first, which is your wages, overtime, incentive pays, and such that are shown in the top half of that slide, we expect it to increase by 7.3% or $9.8 million. Wages will be about $8.8 million higher. Big pieces of that 8.8 would be the SAFER program, which is about $2.4 million. And also we have quite a few academies. We have 4 academies planned this year. That's another about $2.4 million as well. So we're really anticipating staffing up heavily in 24-25. And that is contributing significantly to the wage increase. Constant staffing is just a shred lower at $428,000. Incidentally, constant staffing is still remaining high. Remember, it's just lower than the mid-year number. So we typically, in the years, we've seen our preliminary estimate go down because we anticipate, we've come out of COVID, or we're able to stand up more MMPs, or there's other sources that we've been able to identify that we thought it would go down. We're just not seeing that anymore. It's really the leaves that are available, people are taking them, and that drives up constant staffing. So that's why we're budgeting at about where we are for mid-year. Incentive pays are going up associated with wage increases as well. The employee behavioral wellness incentive is about $2.9 million. That's an ongoing part of our budget now. On the benefits side, it's going to increase about 5.4%. The big piece there that we knew was coming was the CalPERS pension contributions of $7.5 million. That's reflecting that poor market performance they had 2 years ago. Employee medical costs, $1.6 million. Workers' compensation, actually anticipating that they go down significantly from what we had in the mid-year. We had $6.2 million in the mid-year, and we're now about $4.2 million is what's in the budget. And that's a reflection of what we've seen with the new third-party administrator. The costs have really gone down significantly, and you'll see that in that regular monthly report you get as well. There's also not included in this budget would be the Section 115 pension trust, which was discussed during mid-year, setting that up. This budget does not propose to set that up just yet. Obviously, we'd like to see the reserve tick up before we can do that again. So that is not included in the budget. Services and supplies, so just to tick off a few items. Again, I mentioned it's about a 2% increase in service and supplies. Some of the main items there would be liability and property insurance are up by $596,000, $339,000 for fire equipment servicing, dispatch services. There's been a new contract negotiated. We had to increase our contribution there by about $418,000. We are seeing a decrease of about $606,000 related to the gurneys that we funded last year in final. That really reduced the maintenance costs and repair costs that we used to have there. And then finally, we also seen a decrease in communication equipment supplies related to some CIP projects. Now I'm going to jump to capital outlay summary. So the total spending in capital outlay is $48.8 million, as you can see there. Some of the main projects, which were also on Ms. Castleberry's presentation, ladder truck replacement, $1.7 million. The 4 new ambulances, $1.2 million. 5 Type 1 engines at $5.4 million, and the 4 Type 3 engines at $2.2 million, and the technology, storage, appliance replacements, which we're all looking forward to, $415,000. And then we also have major capital outlay projects that are funded from other funds. Again, these 2 station projects there, Grant Line 220 acquisition, and the Vineyard Spring Station, about $12.4 million together out of the Development Impact Fees Fund, and the Zinfandel Training Project. This is moving on to the projection. So where are we headed now? This is the general fund budget projection over 5 years. What can I tell you? Some background around this. This includes economic data from the Bureau of Labor Statistics and the property tax data is from our property tax consultant, HDL. Annual inflation is at 2.5%, just held through the forecast period. This is a little higher than where we are today. It's maybe on the conservative side, but I think that would be appropriate right now. The cost of borrowing rate is about 4.5% in the budget year, and then it'll gradually step down to about 3% in 28-29, the last year there. The PPGMT and the VRP, those IGT programs, are grown at about 2%. Not expecting a big change with those. And then compensation is grown annually at 3%, which would include all sorts of compensation increases, whether that be promotions, raises, wage increases, budgeted at 3%. So the red line, I'll read out the numbers so you can track what's happening there. Again, we saw on the second slide I showed you, which was the 11.3%, is a projected reserve in 24-25. 25-26, there is a slight rise to 11.4%, and then 12.3% in 26-27, 13.5% in 27-28, and getting up to 14.7% in 28-29. That's the red line. The green line is 15%, just to show you what that would look like. You can see where the red line tracks relative to the green line. And then the blue bars there, as shown, are the ending general fund reserve. So as you'd expect, your reserve climbs up typically, and you're going to have the reserve percentage will also go up. So the big drivers here are pretty obvious: labor costs and property tax growth. Those are the main drivers that dictate the direction on this slide. But long term, we are expecting a continued steady, if slower than what we've seen, property tax growth. The table at the bottom there shows the property tax growth in each of the years. It goes as the 3.7% we're anticipating in 24-25, goes up to 3.9%, and then goes up to 4%, and again 3.9, and then 3.8. So really steady, just under 4, I guess add 4 1 year, for the 5-year projection. This next slide is where I'm tying into the CIP presentation. That's very similar to the slide we just saw. Again, there's 51.2 million in expenditures for this fiscal year. There's 27 projects, 18 new and 9 carryover. And then the makeup by fund, I guess, is what is the fiscal takeaway at this point. So the general fund is contributing about 5% at 2.6 million. Special projects fund is contributing about 27% at 14.1 million. Development impact fees, 30% at 15.5. The capital facilities at 37% at 19.6 million. And then leased property, again, that little shred, 0.3%, 135,000. So these are just a summary takeaways. We've covered all this, but the general fund budget is balanced through a reserve transfer of about 6.8 million. The budget decreases forecasted general fund reserve from 13.4% in the mid-year down to 11.3%. There's revenue growth, including net transfers, is budgeted at 3.5% higher than the prior year. And we do have the PPG and VRP. They're still adding about 22.8 million, very close to what we saw in 23-24. And then expenditure growth is budgeted at 6% higher than the prior year. And as the 5-year forecasts show, we expect the reserve borrowing likely one time, and then gradual property tax growth will lead to a steady increase in the general fund reserve. It's subject to property tax trends and labor cost commitments. The recommendation is to approve the seven resolutions adopting the preliminary budget for the fiscal year ending June 30th, 2025. Before I do that, I do like to just take a moment to point out a couple things about our budget. First, to thank the divisional budget officers, the executive team, and the finance team, particularly Tara Mailer, Sarah Ortiz, and Ron Empedrad. Is Ron here? He's in the back. Thank you, Ron, for putting this together. And also want to note one enhancement in the positions and authorization document. We've changed the columns, so there's no longer three descriptions: authorized, actual filled, and funded, and now it just simply says established positions and budgeted positions. Hopefully that brings simplicity and clarity to that issue, which I've struggled with myself. And then finally, I have some late-breaking budget news. The department was recognized. their 23-24 final budget was awarded the Distinguished Budget Presentation Award from the Government Finance Officers Association of America. So we're in a group of about 1% of local agencies that receive this type of recognition. Last year, we received similar recognition from the California Society of Municipal Finance Officers, and there's long names, but this is the first time we've got the national recognition. So it's pretty special, and we're just pretty pleased with ourselves. So with that, I will take, thank you. With that, I welcome your questions.
Well, congratulations, Mr. O'Toole, to you and your team. That's awesome. Wonderful news. Do I have any questions from the board? No.
Just to say a sincere thank you for all the detail and diving into all these different funds and explaining it to us. Thank you. Thank you very, very much.
The one thing I didn't see in this was the comment on how we're doing in our OPEB funding. I know we talked about that a few months back, and has there been any change? We still on track?
Yeah, we, that was the last presentation. So it's built in, and yeah, there hasn't been, in terms of the market performance, hasn't been.
Yeah, and also making sure we're meeting our ARC.
Yes. Yeah.
Okay, that hasn't changed. Yes. Thank you. All right, well, we do have to take all of these separately. We have 7 different votes we'll need. So I'll start with Resolution 2024-25 regarding the General Operating Fund 212A.
So moved.
I got a
Second.
I got a motion and a second. Can we get a roll call, please?
Yes, Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes.
Mr. Chair, I move Capital Facilities Fund 212D.
Second.
I've got a motion and a second. Can we get a roll call, please?
Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you.
Back and forth. Okay. Mr. Chair, I move Grants Fund 212G.
Second.
I got a motion and a second. Can I get a roll, please?
Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes.
Mr. Chair, I move Development Impact Fees 212I as in Ida.
Second.
I've got a motion and a second. Can we get a roll, please?
Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes.
Mr. Chair, I move Leased Properties Fund 212L.
Second.
I've got a motion and a second. Would you call the roll, please?
Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes.
Mr. Chair, with your permission, I move the IGT Fund 212M.
Second.
I've got a motion and a second. Would you call the roll, please?
Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes.
Thank you so much, Mr. O'Toole.
Wait,
We have
For
one more.
special project.
212S. Yes.
with your permission, Mr. Chair. Special Projects Fund 212S.
I already marked that one off. All right, I've got a motion and a second. Can we get that one called, please?
Yes. Director Sailors.
Aye.
Director Weber.
Aye.
Director Sheets.
Aye.
Director Wood.
Aye.
Director Rice.
Aye.
Director Jones.
Aye.
Director Costa.
Aye.
Director Clark.
Aye.
Thank you. Motion passes.
Thank you so much, Mr. O'Toole. All right, moving on to reports. I have nothing, and President Gould left me nothing to report on his behalf, so we'll move on to the fire chief's report.
Yes, good evening, directors, colleagues, member of the public, and I'd like to start off in welcoming a new hire, and Gloria, thank you for being patient in a long board meeting. Gloria Gladys, I hope I got that name right. Please note, she does not want to come to the podium. but she's back there patiently waiting. Gloria was hired to the position of Emergency Medical Service System Technician in the EMS Division effective May 6th. Welcome, Gloria, and glad to have you on board.
Welcome.
Once again, thanks and congratulations to Mark Jones and Marie. Congratulations on your retirement. Some events real quickly. On May 31st, Assistant Chief Farika, Assistant Chief Lozano, and I attended the 23-1 CalJack Paramedic Academy graduation with President Rice. They graduated a whole group of new paramedics, and they offer those recruitment services to 175 departments throughout the state. And it's a great partnership with them. Following that partnership, we also sent some of our paramedics down to help with their interview process for their next battery of EMTs. So that collaboration is working extremely well, and we look forward to growing that in different avenues also. Thank you to the members who helped coordinate the Station 51's open house, and Director Costa was there. Great turnout. The crews there did an exceptional job, and I think Chief Wagaman will probably talk about in his report out, saved the district a ton of money by doing self-improvements like we used to do old school, so I can't thank those crews enough, and the station looked absolutely beautiful. And then we had a promotion ceremony on Tuesday where we gathered and honored the milestones and accomplishments of 19 of our members who were promoted between October 2023 and June 6th. Thank you to everybody that was involved and Director Weber for attending. It was a great ceremony. And then lastly, yesterday, it was an honor to host the National League of California Cities Public Safety and Crime Prevention Committee, where we had all of our executive team attend, and Director Jones, thank you for attending. We got asked to speak upon partnerships, specifically with our cities, fire prevention policy considerations. Our MIH was obviously requested and entertained and valued. Very interested in there. And the last thing, which we took also back to CAP, was a very high interest in our American wildfire problem, the WUI problem. And Chief Mitchell and Jeff Fry spoke on that and had a ton of questions. That collaboration in committee, we look forward to working with them in the future also. And that's the end of my report, unless you have questions.
Thank you very much, Chief. Any questions for Chief House? Thank you. We'll move on to the operations report. Deputy Chief Mitchell.
Thank you, Director, and good evening to all. Battalion Chief Grant Russell is going to join me up here. I know we've seen a lot of phenomenal presentations tonight from some incredible professionals that work for this organization. I'd just like to take a quick moment and recognize personally from my level of thanks to Assistant Chief Johnson and Assistant Chief Rudnicki for providing the service delivery update on top of their day jobs. I asked them to come up and be a little bit out of their comfort zone and provide you that update. So to both chiefs, thank you very much for your job and job well done. Another phenomenal individual is Battalion Chief Grant Russell, Special Operations Battalion Chief, but also in charge and helping with our vegetation management plan training burns. And so I'm going to have him come up, talk a little bit about that, and then talk about how it's already starting to pay dividends on the training end of our relationships growth as well. So Chief Russell.
Good evening, directors, Chief House, colleagues and members of the audience. So this year, at the direction of the training division, we tried to get back to a regional wildland drill like we used to do pre-COVID days. So we planned live fire training on 3 different shifts for this year. And so far we've completed 2 of them. One day had to be canceled due to the weather. It was unfavorable conditions that day. And we actually ended up with a very busy day that day just due to the call volume and reaching drawdown with our resources. So we've combined our vegetation management projects, which is helping our local land management partners, in this case Sacramento County Parks, and the Center for Natural Lands Management that manages the Illacalla Preserve, which is just south of here in the community of Mather off of Zinfandel. And we've been collaborating with them for several years now, and we are starting to see benefits of these training burns in the restoration of the native species and getting rid of the invasive species down there. So today we've completed 2 of those burns. The first one was 125 acres, and Director Weber was actually in attendance for that burn. and then the second one was 75 acres. So far, we've completed about 250 acres. Tomorrow, we plan to burn about another 80-ish acres, depending on weather and timing, and that will be the final burn for this year. The drills, we've been focusing on interagency, so we did invite all of our regional partners. We've had 2 of them accept and participate in every drill, and that is the Sacramento Department of Airports and our CAL FIRE partners to the east from the Amador El Dorado Ranger Unit, it's no longer a Ranger Unit, it's the El Dorado Unit. The focus has been on that interagency coordination, communications, operations, and we're integrating everybody from all the agencies and integrating everybody into working together. So getting rid of the divisions and getting crews used to working together before we actually meet up on the actual fire ground, and getting over those hurdles that we always have with communications and just not being comfortable with each other's operations. In support of that, we also have recently graduated a fire academy, and we're making every effort to get our newest members out to these drills, so trying to get experience for our most inexperienced people. And this is a great opportunity, and I think we've been successful on 2 shifts, and hopefully tomorrow we'll be successful on the 3rd shift. The burns are focusing on reintroducing fire into the landscape, reducing the hazardous fuels buildup, and the reduction in invasive plant species. So yesterday, we actually saw a benefit of all this training. So I'm sure you're aware of is we responded to the Grant Line incident, or a Grant Line in White Rock. So we responded to a 120-acre fire in the state responsibility area within our jurisdiction. So what that does is it means we're responding it's within our jurisdiction as the first responders, but our CAL FIRE partners are responding down due to their statutory responsibility for the state wildlands. So Metro Fire Crews and CAL FIRE Crews, we integrated into a unified command structure, which was actually very seamless because we had already done it 2 times before in training scenarios. And the players already knew each other, and we had gotten over that awkwardness of working together. And so we actually had probably one of the most smoothest run incidents in the SRA that I can remember. And I think it is due to the training and then to the collaboration that we've developed over the last several years with CAL FIRE and our other regional partners. So on that fire, Metro Fire responded with 6 engines, 2 water tenders, 1 bulldozer, 1 helicopter, and multiple chief officers. Well, our CAL FIRE partners responded with 6 fire engines, 3 hand crews, 2 bulldozers, 1 air TAC, 4 air tankers, 1 helicopter, and several chief officers. So we had a very large structure that ran very smoothly due to the training that we have done in the last couple weeks. So training prior to these large incidents with our cooperating agencies makes for a more effective and coordinated fire response and makes us more efficient. So we handled the 120-acre fire in a relatively short period of time, and then we were able to get our resources back into their first-in areas, and then CAL FIRE took over responsibility for the incident once the emergency was mitigated. And that's all I have, unless you have any questions.
Thanks so much. Do we have any questions? Director Weber?
Yes, could you expand upon another portion of the collaboration? I found it fascinating, the radio integration that you've done as far as they have ours, we have theirs now. I mean, that's got to be extremely helpful to us. And again, forward thinking on your parts.
So that, if I'm not mistaken, I think their CAL FIRE's chief officers now have 800 radios, and we train them on how to use them. So their chief officers are now able to hear what's going on our TAC channel before they arrive on scene, and before we start switching over to the VHF tactical channels. So it's actually made the communications easier because regardless of whose channel we're on, the command staff is able to communicate back and forth and just kind of eliminate some of that awkwardness and inability to communicate that we've had in the past.
Any other questions?
So just real quick, Chief Russell doesn't know about this part, but we talk about the folks that work for us and the professionalism and their longstanding dedication to our community. Chief Russell's heavily engaged across the district and many years of experience with the wildland side of the house. He's also the incident commander lead this year for the Sacramento Regional Incident Management Team, and also as a special operations battalion chief, runs a number of our programs here internal to the district. But it is my honor and pleasure to also recognize that back on May 2nd, 1994, somebody came into the organization at that time 30 years ago, and I would have done this before, but somebody was also in Italy and Spain and other places during that time, so I get to do it tonight. So it's my honor and privilege to present Chief Russell with his 30-year service pin tonight from the board.
Congratulations.
And that completes the report.
Thank you so much, Chief. Appreciate that. Congratulations, Chief Russell, wherever you, congratulations. Next, I have it on authority that we have no report from the Administrative Division. Thank you. Moving on to Support Services and Deputy Chief Wagaman.
Good evening, Board of Directors, Chief House, and staff. Tyler Wagaman, Deputy Chief of Support Services with your support report. Starting off with facilities, already briefly talked about Station 51 open house, huge success. Yeah, I have to mention sweat equity is contagious. It's inspiring. It adds ownership, and it's very cost effective for the organization. It doesn't cost us a whole lot of money to drop a few yards on the front bay and have the firefighters step up and help out, and that's exactly what has happened at every single one of these stations, and we're going to continue to do that. So specifically Station 51, 4 yards of decorative rock to help freshen up the landscape. The apparatus bay lights were all replaced with new LED lights. Again, very inexpensive, but makes a big improvement to these fire stations, and it's much needed. As well as replace several broken and stained tiles. Director Costa, you can probably attest now that that station has a lot of tile. It's a house of tile. Roof-wise, either completely replaced or repaired, Station 21, Station 4, and 2101 Hurley. Station 50 dorm project is complete. They have reoccupied the space. They love the space. Facilities and our contractor did a stand-up job. Station 22, new parking lot stripe and seal. Station 65, new HVAC unit. On the fleet front, we expect 6 new ambulances to hit our fleet division within the next week. So we look forward to getting those outfitted and out on the street and get them into service. Community risk reduction. It is weed abatement season. It's the first week of June, and we're hearing 100+ acre grass fires. That's incredibly concerning, and to be focused on weed abatement is a big deal. And we need the folks that are responsible in the community for those that have large parcels to mitigate those so we don't have large fires. That's our goal, is to keep that community safe. So 689 notices to abate letters went out on May 1st. CRD completed the first round of inspections the first week of June. Second notices to abate, a total of 148 went out. And that second round of inspections are going to occur in the second and third week of June. So total of 78% compliance rate on that first round. So doing pretty good. Fire investigator sergeant successfully completed his probation on June 12th. Congratulations to him. Investigator Morton had a arson arrest at Jackson and Excelsior just the other night. So we were able to apprehend him during the firefighting operation and get that individual off the street. So congratulations for him. Metro Fire is going to be hosting the Sacramento Regional Fire Prevention Officers meeting. It actually happened today, right? So it already occurred. Fire investigators and inspectors will be attending training provided by the Office of the State Fire Marshal on fireworks laws and regulations, recognition of safe and sane and illegal fireworks and explosives, resources for local agencies, fireworks safety, and burn statistics. The fire investigators and inspectors will also be attending training for the Sacramento Sierra Arson Task Force on June 18th within Placer County. Last but not least, and certainly most important, we have a trio tonight, another recognition. And this individual has, I had to pull out the calculator, and almost tapped it out when I started running the math. 11,000 days in membership with this agency. Over 88,000 hours of regular duty time worked. Yet overtime, we're talking over 100,000 hours of dedication to this organization. Assistant Chief Law, can you please come forward? So Chief Law is also celebrating 30 years of dedication to this great agency, actually 30+ years. I already gave her her pen this afternoon, so I didn't want her to leave empty-handed, so I wrote her a short letter. And it is as follows. It says, Dear Chief Law, congratulations on reaching an incredible milestone of 30 years in dedication of service to the district. Your unwavering commitment, leadership, and passion have made a lasting impact on Metro Fire and the communities we serve. Your guidance and wisdom have inspired and uplifted us all. Throughout the years, you have exemplified professionalism, integrity, and excellence in all that you do. Your hard work and tireless dedication have not gone unnoticed, and the positive influence you've had on the district has been immeasurable. Thank you for your continued commitment to making our district a better place for all. Here's to celebrating your remarkable achievement and many more successes yet to come. Congratulations once again, Chief Law, on this significant milestone. Your dedication and leadership are truly commendable. With heartfelt congratulations. Thank you. And Director Wood, end of report unless you have any questions for me.
Thanks so much, Chief. Do we have any questions, comments? No? Appreciate it. Thank you. Moving on, we have Firefighters Local 522 report. Welcome.
Good evening, Board, Chief House, esteemed colleagues. Mike Gildone, firefighter Truck 106 C Shift, Director Local 522. I apologize, I didn't bring goodie bags, so thanks for that, Parker. But it is VP Scollard's birthday, so I twisted his arm and forced him to let me come in here and do the report tonight. I'll keep it brief. One of the more important events that we attended was the PFAS rally at the Capitol a couple weeks ago, and one of our own members was able to speak about his battle with cancer, and that was Captain Carl Jewell. He did a great job, and it was a really great event. Other than that, I have been fulfilling our second full release position for the last 6 weeks, I believe, and it's been great. To speak to Chief House's comment on collaboration, it's been really good for me to be able to go out and interact with a lot more levels of this organization than I would normally be able to on a 4-day or a 2-day or a 1-day or how many days I'm going to get between my callbacks or mandatories or my job with the union. So it's been really good. And I will say, to Chief House's credit, that I feel that it has provided a lot of fruit already, and we are excited about continuing that relationship going forward. One thing I do want to touch on is the standards of cover document. We're talking about collaboration. While that is a great document, I will say here what I say in the room with anybody else who will listen to me. That document can't quantify what it feels like to be out on the road, and that's our job, to represent that. And I will unapologetically always be that voice. And going forward, with your support, I know that we'll be successful in that endeavor. So I just want to say thank you. If you guys have any questions for me, that's the end of my report.
Do you have any questions for Mr. Gildo?
Thank you.
Thanks. Pass happy birthday wishes on to Sean, would you?
It's also Director Votava's birthday. They're birthday buddies.
Pass our wishes on to both, please. All right, moving on to committee and delegate reports. We have no report from the executive committee. Com Center JPA, there's no report. Their next meeting will be June 11th at 9 a.m. Finance and Audit Committee, Director Jones.
Thank you, Mr. Chair. The Finance and Audit Committee did not meet tonight. However, our next meeting is June 27th, 5:30 in these chambers.
Thank you very much. Policy Committee with Director Costa.
Thank you. The Policy Committee met today. We had one presentation item, administrative policy on timekeeping and attendance. There were some edits made, correcting the shift, 24-day work cycle shift from 10 to 8, update to the payroll email, and then rules on rounding of time. And so that was administrative policy, won't be coming to the board, but the Policy Committee did review it. Thank you. Oh, I'm sorry, and our next meeting is July 11th.
Thank you very much. Moving on to board member questions and comments. I'll start to the far right with Director Sailors.
Thank you very much, Mr. Chair. Tonight, I just want to say thank you to everyone for all of the great presentations and the wonderful information. And I want to say congratulations to BC Grant Russell and Assistant Chief Barbie Law on their 30-year pin. That is a great accomplishment. And my voice is going, so that's all I have left. Thank you.
Thank you very much. Director Costa.
Thank you. Yes, I want to echo just great reports tonight, a lot of great information, and thank you for the leadership to get that information to us early so we can have a chance to review. And I do want to say thank you to Station 51. The open house was great. I had the opportunity to hang out for the day sometime back and clean those floors. And so it was great to see all the great work that they did. And to the team for just getting the community out there. I think it's a great opportunity to bring the community in. So thank you.
Thank you, Director. Director Jones.
Thank you, Mr. Chair. Terrific presentation items, action items, incredibly thorough, super high level of professionalism. I appreciate it. A big thank you to our 30 years, Brenda, Chief Russell, and Chief Law. Terrific, terrific. A quick note, I mean, it was back in the mid-90s when I first started working with Brenda, and we were working, I was in fire prevention with the city, and she was here, and we initiated the Juvenile Fire Setters Program for intervention, not only for the individuals, but for the families as well. My understanding is that's still an ongoing project. So just an acknowledgement, that was one of the very first times I was able to work with her, and I greatly appreciate that. Okay, quickly, well, the CERT team, super duper. Again, one of the quick examples that they work with are the successor to Epi's Great Race, the Great American Triathlon. They're always there working with security and radios and first aid. That's just one example of the many events and activities that they assist with and help facilitate within our community. It's terrific. I did have a terrific, well, I keep saying that word, but it's all good. The Cordova Community Council had a very moving Memorial Day service commemoration, and I wanted to acknowledge Cordova Community Council for the excellent work that they did. And they had Ami Berra's Chief of Staff, Matt Satoni, excuse me if I butchered that last name, but Matt did a terrific job with a very moving speech about his military experience and tying that into all of our lives today. So thank you to the council for that.
Thank you very much, Director. Director Weber.
I just want to congratulate the old folks in the room, both years of service and your retirements. Congratulations.
Thank you, Director. Director Clark.
Yes, I also want to thank the, what do they call it, 30-year retiree, commendations, and Mark Jones and Miss Marie. I wish you a very happy retirement. Thank you for your years of service. Great presentations. I don't know what else to say. There were so many great presentations that it's pretty much overwhelming. We got a great organization. I'm so proud to be allied with this organization and be able to serve. You're doing a great job for the community and with the leadership of the chief. We're doing great things. So, thank you.
Thank you, Director. Director Rice?
Just Grant and Barbie and Mark and Marie, and I know Brenda's out there somewhere, congratulations. Don't fail at retirement like some of us are. The other one, I really appreciate Aaron and Dave in your presentations and how thorough they were and really giving us a good look into our future. John, the EMS report, you guys have no idea how important the work that you are doing is doing, and it's going to be very important at a statewide level. So I really appreciate that this organization truly is on that cutting edge. And just to say, I'm honored to be a part of this board and serve the community of Division 7, and that's all.
Thank you very much, Director. Director Sheets?
I too want to wish you a happy retirement and congratulations to the 30-year recipients. And I want to wish all of the fathers in the room and who's out in the organization a very happy Father's Day. I hope you get spoiled. That's all.
Thank you very much, Director. The curse and the blessing of being last, as everyone has already said everything so eloquently, so I'll ditto that. And I will just add a reminder, June 29th, the Burn Institute's Luau on the Links over at Hagan Oaks is happening. They do need volunteers. We do need some firefighter volunteers to do some, participate in the ticket raffles. And expect everyone else to see all the rest of my colleagues there in some capacity or another. So with that, we will move into closed session, and I hope not to see anyone when we come back.
Recording stopped.
Yeah.